Hello, I'm Roberta Levin, and I'm going to walk you through mastering documentations by writing SOAP notes. Most of us know that documentation in healthcare is a necessity, but what I want you to understand is why it's so important to the quality and continuity of your care. The SOAP note is written to facilitate communication about the care of the patient and continuity of care across providers. We must always remember that we are not the only provider, and so everyone needs to know what we were doing and what we were thinking. The absence of complete documentation in patient medical records can have a negative effect on statistical databases, financial planning, clinical preparedness, and gross revenue for the healthcare organization. In other words, poor documentation impacts your bottom line. It impacts the amount of funding your organization has. If your funding is impacted, it also has an adverse impact on your ability to care for those who can't afford to pay. And the final point I would like to make is about the legal protections of good documentation. Having sat on a review board for several years that looked at malpractice cases, one of the things I will tell you is that if it was written, we considered it to be done. However, if it wasn't documented, we had no way of knowing what care you had or had not provided. Therefore, the assumption was if you didn't write it, you didn't do it. We all know that that isn't the case and that there's no way to write down absolutely everything you do, but the fact of the matter is you need to write down as much as you can to give an accurate account of your care. So what exactly is a SOAP note? A SOAP note basically is documentation that's divided into 4 sections: the subjective, objective, assessment, and plan. Some people like to make something we refer to as a SOAPy, which adds IE. And the I is implementation. So you record how the action was carried out. And the E is evaluation. So you report the patient's outcomes. When you start your note, it's always best to start with the demographics. The demographics are the patient's name. However, when you're writing SOAP notes for class on real patients, please never, ever, ever put the patient's actual name in the note. We want to make sure that their confidentiality is maintained. Put the date of birth, age, gender, the medical records number on every page, and insurance if applicable. Now, if the insurance has been recorded previously in the chart, you don't need to document it every time. But as a provider, you do need to be aware of it. Different insurances pay different amounts for medications and have different places that will accept them. So it's important to be aware of that to assist your client. So let's start out with the subjective and what we mean by subjective. It is the initial portion of the note, and it's the portion of the note where the patient reports how he or she is doing. It is what the patient or the significant other tells you. In other words, you start out with the chief complaint. You want to know why the patient came in to see you. It's likely that you will get an answer about follow-up or renewal of their medications, or you might get, I've had a sore throat for 3 days, or I keep having migraine headaches. You need to document whatever the chief complaint is and in the words the patient uses. Then you want to get a history of present illness. That might be something like asking them, How long have they had it? Is there anything that makes it better or worse? You will want to find out if they're currently taking any medications for the illness, or are they taking any medications at all? And if they are, you want to the extent possible, get the name of the medication, the dosage, who prescribed it, how often they take it. And this should include supplements and over-the-counter medications. Always make sure you've documented any allergies that your patient has. And then you want a focused review of symptoms, a social history, and to know their habits, and past medical history. Remember that the past medical history isn't necessary on all visits. If you have an established patient, that you have a good medical record that has been maintained, then you're going to have the past medical history already documented. It's a good idea to make sure you note that you did review the chart. The focused review of symptoms is going to depend on the condition. Always make sure you know about their social history and their habits. One other form that is sometimes used in documentation uses the acronym OLD charts, where you document the onset, the location, the duration, the character of any pain they're having. So is it sharp or dull? Any alleviating or aggravating factors, radiation, temporal pattern. And by that we mean, does it occur on regular intervals? So only first thing in the morning, it occurs every evening, it only occurs right before I go to bed, it only occurs when I'm lying down at night. And then any symptoms that are associated. The objective information is the section that focuses on measurable data that you collect. This is the vital signs, any physical examination findings you have, any laboratory studies, x-rays or other scans, any other tests, and age. The assessment is your diagnosis. And as nurse practitioner students, this is going to be one of the more difficult adjustments that you're going to have to make. You will no longer be using nursing diagnoses. You will be using medical diagnoses. If it is clear that there is only one diagnosis, strep throat, for example, because you have a positive strep test, then you would make that one diagnosis. However, there are many cases when a patient comes in and you are not sure exactly what the diagnosis is, or it isn't clear yet and you have tests pending. In that case, you would use differential diagnosis. So let me review this so you understand. You're not using nursing diagnoses anymore. And it's okay, and in fact a good thing, to list differential diagnoses until you are sure of the correct diagnosis. And then you want to make your plan. Your plan for treatment should include what you are going to do, their testing, their education, and any follow-up. So any medications that you order, any referrals you make, any labs or radiological tests that you order, any treatments you perform in the office, any education that's provided, what the patient's disposition is, and then any follow-up. Be sure that you are really familiar with the type of documentation you're using. Some electronic medical records link the plan to a specific diagnosis. So in some of the electronic medical records, when you write medication orders or an order for a test or a lab, it's going to ask you which diagnosis you link that to. You're going to have to make sure that you know and have a good rationale for why you're writing each order. Not all notes are alike. And you don't need to do a complete history and physical every time you see a patient. So you can have different types of focused exams. You can have focused exams for acute illnesses, urgent care, periodic evaluations of chronic conditions. And a focused assessment does not look at every body system every time you see the person. You're only looking at what is applicable to the chief complaint. You will also have well visits, and well visits are especially common for children and for women. And finally, you will have prenatal care, which will have its own separate type of documentation that will be covered in a different lecture. I want to give you some guidelines for writing your notes and then link you to a site that gives you some really good sample SOAP notes. Be sure to write the patient's name, their ID number, and the date on each page of your notes. Again, remember, for the SOAP notes you're submitting to me about patients, do not put the client's name on the SOAP note. Always write your name clearly. Other providers need to know who you are, and your patient needs to be able to read your name. Be sure to organize your information by problems for which your patient presented. Be sure your assessment and plan represent the subjective information. You should not ever be providing new information in the plan section. The plan should relate back to what you've already documented. Be sure to list all medications, or if there is a medication list, document that you reviewed it. Always be specific about your follow-up plans. It is best to say when you want to see the person back again, and to give a specific timeline, if at all possible. As a student, you must list the name of your preceptor on all of your documentation. And finally, I would like to link you to some excellent SOAP notes, and the link is provided here to UNC, and they have a variety of notes that you can look at, and this will give you a good idea of what is expected of you. If you have any questions, feel free to stop by my office or to email me or to give me a call. I would be happy to talk to you further. Thank you.